this video is going to contain some heavier topics, so I just like to request that everyone is polite to each other and that no harmful jokes are made in the comments. I have a few content warnings, so if any of these disturb you or make you uncomfortable, feel free to click off and go watch some, I don't know, cute animals or something. As for the warnings, this video contains mentions of an eating disorder, passing out, cancer, alcohol, stroke, anxiety, depression, and more. If any of these disturb you or make you uncomfortable, do not continue watching. For those of you who can continue along with me, I thank you for taking the time out of your day to listen. But with all the preventives of a lawsuit out the way, let's get started, shall we? To get us started, we will first look at orthostatic hypotension, or also known as postural hypotension. The reason for this discussion in particular is because I have a friend who, for the sake of remaining anonymous, we will be referred to as Yin. Now, I was talking with Yin a while ago, just texting before school, when they brought up that every single time they go to stand up, their vision goes dark and they feel like they pass out for a moment before their vision returns to them. Naturally, this concerned me and I recommended they go see a doctor. However, they are quite stubborn and their parents had apparently watched this go on for about 2 years and hadn't thought anything odd of it. Eventually, we came to the agreement that they talked to their parents and I'd help them see what they might have. So I went to Google, like every other person who self-diagnoses, and typed in their symptoms. And the first thing that pops up is an article about orthostatic hypotension. We looked into it a bit and found that, yes, this is possibly what they have. However, their parents, after Yin told them they should probably go see a doctor, they just said that it's because Yin's eating habits aren't the best, and that they'll go to a doctor if it gets worse. Now, this reaction is by far an understatement, I feel. However, I can kinda see the logic behind it. Nothing has happened yet, so it should be fine, right? And I'm afraid the answer to that is no, it's not. I'm afraid that yet is about to bite them in the butt. So I'll be going over all the symptoms, causes, what it can lead to, and so on, so that if you're in a similar boat to Yin, maybe this video can help convince your caretakers that something isn't quite right. With that said, let us begin. Now, orthostatic hypotension is a form of low blood pressure. It can cause brief episodes of lightheadedness, dizziness, and fainting. It usually happens after, say, you've been laying down for too long and stand up too quick. This is perfectly normal and easily treated. If symptoms persist, however, and it stops being able to be treated by the usual methods of drinking water more regularly or being more active, that's a sign of chronic orthostatic hypotension, which is a sign in of itself that something more dangerous is going on unseen. It's important that if you lose consciousness, even for just a few seconds, that you go see your health provider right away. If you're unable to go see your health provider, however, it helps to keep track of your symptoms. For example, when they happened, how long they lasted, and also what you were doing at that moment. Low blood sugar is typically when you're sitting or laying down, as gravity causes blood to collect in the legs and belly respectively. Your blood pressure tends to drop when there's less blood flowing to the heart. However, our brain has a special trick for when this happens. Baroreceptors near the heart and neck arteries sense this low blood pressure and sends a neural signal to the brain, which then sends a command down to the heart to beat faster and start pumping more blood to even out the blood pressure back to normal. However, orthostatic hypotension occurs when something interrupts this process, such as one of the following, or some combination of them. Dehydration can be caused by fever, vomiting, not drinking enough fluids, severe diarrhea, and strenuous exercises with a lot of sweating. Dehydration decreases blood volume, and mild dehydration can cause symptoms of orthostatic hypotension, such as the aforementioned ones of weakness, dizziness, and fatigue. Some heart conditions that can lead to low blood pressure include extremely low heart rate, which is known as bradycardia for the more scientific bunch, heart valve problems, a heart attack, and heart failure. These conditions prevent the body from pumping more blood when standing up. Endocrine systems such as thyroid conditions, adrenal insufficiency, also known as Addison's disease, and low blood sugar, which is known in the medical world as hypoglycemia. Hypoglycemia. I'm not sure if I'm pronouncing that right. Sorry. I apologize to any medical professionals watching this if I'm offending you. All of these can cause orthostatic hypotension. So can diabetes, which can damage the nerves that help send signals that control blood pressure. Some nervous system disorders, such as Parkinson's disease, multiple system atrophy, Lewy body dementia, pure autonomic failure, and amyloids, can disrupt the body's ability to control blood pressure. And eating meals. Some people have low blood pressure after eating meals, which is another thing called postprandial hypotension. This condition is more common in older adults, so us young people don't have to worry about it as much. Whew, trying to say all those 5 times fast, that's a real challenge. Anywho, those are some of the causes of orthostatic hypotension. These are the majority, but the body is a fickle thing. There might be a blood clot in your bloodstream preventing proper flow, or something completely different. Everyone's different, as well as possible causes. That's why it's important for you to find the cause so you can prevent it from continuing. Otherwise, it'll just keep coming back time and time again. Like that mouse your cat just can't seem to grab. Now, I'd like to put a disclaimer for the next portion. Just because these are risk factors doesn't mean you'll instantaneously get orthostatic hypotension just because of one or more of these factors. Bodies work differently, and with proper care can circumvent some of this even with exposure. It's important to keep living your life the way you want, but take caution, and if something feels wrong, it likely is. Without further ado, let's move on to the risk factors. First comes age. Orthostatic hypotension is common in those who are age 65 and older. Special cells called baroreceptors near the heart and neck arteries that we've already discussed that control blood pressure can slow as you age. It can also be harder for an aging heart to speed up to make up for drops in blood pressure. Next we have medications. These include medications used to treat high blood pressure or heart disease, such as diuretics, alpha blockers, beta blockers, calcium channel blockers, angiotensin covering enzyme inhibitors, and nitrates. Other medications that can increase the risk of orthostatic hypotension include medications used to treat Parkinson's disease, certain antidepressants, certain antipsychotics, muscle relaxants, medications to treat erectile dysfunction, and narcotics. Then there are certain diseases which we've already identified, such as heart valve problems, heart attack, and heart failure, Parkinson's disease, and diabetes. And then we have heat exposure. Being in a hot environment can cause heavy sweating and possible dehydration. Now, surprisingly, bed rest is also a risk. Staying in bed for a long time because of an illness or injury can cause weakness, which can lead to orthostatic hypotension. And finally, everyone's favorite, alcohol. Drinking alcohol can increase the risk of hypotension, because of course it does. That really thinned out as we went down. Now, please remember to take care of yourselves and take caution. You don't have to avoid these things if you're really that concerned about orthostatic hypotension. Just take care of yourself and check with a doctor if you're really that concerned. It's best to get a professional opinion rather than just self-diagnosing. Now let's continue on with the causes of orthostatic hypotension itself and what can happen if it's not caught. There is quite possibly the chance of falls as a result of fainting, which is a common complication in people with orthostatic hypotension. Strokes. The swings in blood pressure from standing and sitting as a result of orthostatic hypotension can be a risk factor for stroke due to the reduced blood supply to the brain. And cardiovascular diseases. Orthostatic hypotension can be a risk factor for cardiovascular diseases and complications, such as chest pain, heart failure, or heart rhythm problems. There you have it. Those are some of the things that can happen if you don't get diagnosed. So, what's more important? Spending a bit of money on a trip to a doctor to get checked out? Or spending at least a few grand, in the States at least, for recovery after the fact? Up to you. And now we come to the second half of this video. Anorexia. No, this is not the eating disorder where you just don't eat for fear of weight gain. This is something different. This type of anorexia is something I think both me and my mom have. We can eat at any time of day. However, even when we don't eat, we don't feel hungry. You know the sensation you get when you haven't eaten since breakfast and you're just waiting the agonizing long seconds for lunch to come so you can eat that sandwich calling your name? I don't. See, I've always done this sort of thing, which is still not healthy in the slightest, where I'll gorge myself with food and then I forget about eating for at least a day. Maybe two. If it's weekend and there's no food in the house and I don't feel like making anything. Both me and my mom eat mainly for the pleasure of eating something, and because it's that time of day and we need to regularly eat to survive. It's by no means healthy, so that's why I'm here talking about it, to both educate myself and you on this issue. I will warn you, I will be talking a little bit more in between the sections than I did previously. More so, I just want to discuss my experiences and to show that just because something says that if you have this and this, and then you have it, but you don't have one of these symptoms, you don't, isn't as black and white as all the self-diagnosers out there think it is. Now, let's hop to it. I'm sorry if I offended any of the self-diagnosers out there. I am sorry. I don't mean it's an offensive term. Don't sue me. To start, I'd like to mention that with this sort of anorexia, there are two different types. There is the you don't feel hungry at all type, and the I will consume everything on this planet if I have to type. And I'm pretty sure the first one is more common. Now, with these types, due to previous studies, oftentimes the person will constantly feel full, not enjoy the sight or taste of food, which goes more into the food aversion caused by anorexia nervosa, and not wanting to eat around others. Not all of these will fit certain people. I myself don't always feel full, nor do I avoid certain foods, unless I've got some beef with the texture. And by saying I don't feel full, I physically cannot feel my stomach, is the thing. Like, I can't feel when it's empty, I can't feel when it's full. I just know it's time to eat, so I go eat something. Which isn't healthy. Especially since I don't do that much exercise, but that's a topic for another day. With this disorder, there are symptoms that come with it, such as fatigue, nausea, muscle weakness, constipation or diarrhea, and changes to skin, hair, and nails. Now, personally, I don't have any of these symptoms. The most that happens to me with my hair is that it gets greasy really fast. And yes, I am quite tired most days, but that's just myself and poor life choices of staying awake until about midnight and waking up at 7 in the morning. Those were some symptoms. Now we get into the more physical signs. Often there will be little to no interest in food, not eating favorite foods, missing meals, and changes to weight. Again, none of these apply to me specifically, but that doesn't mean that some won't apply to you. For example, I have no issue eating food or trying new foods, and even after I've had a large meal, I will still find a way to cram in more if there's some cream corn just sitting there. There are two here that do apply to me: missing meals and seeing changes in my weight, specifically. I will say there was a time I was a little bit thinner. Believe it or not. I will miss meals if there is no food in the fridge and my mom doesn't expect me to eat something. She makes a lot of food, and she will smack me if I waste it. But that also kind of leads to me gaining a few pounds, since I'm not that active of a person to burn the calories off. Let us start with some of the causes for anorexia. Now, there are a few different areas for causes. For example, the physical. It can be caused by pain, dehydration, dental issues, injury, a loss or reduction of taste and or smell, or even recovering from surgery. Now, I don't show my hands off or anything, but if you take a close look at them, you can see the skin grafts. I had a bit of an accident when I was 3 years old, and I've had to get surgeries for most of my life. That may be a factor in why I have this disorder, but I can't say for certain, as I have not yet gotten the time to get myself properly diagnosed. Surprise, surprise, there's a mental factor to this. Things such as anxiety, an eating disorder, a strong emotional reaction such as grief or shock, depression and stress are all possible factors. I don't have much experience in this area with the mental stuff, I have what is called high-functioning autism that I have gotten diagnosed for, and when I was younger, I couldn't read emotions that well or show emotions that well. I've mainly gone off of context clues and just thinking back on past experiences for how to react to things. Things like death have never really caused me that much distress as a child, and even now. Now, like with orthostatic hypotension, we have some underlying conditions. The common cold, infection, cancer, dementia, diabetes, food poisoning, heart, lung, liver, or kidney disease, HIV or AIDS, or even hypothyroidism are all factors possibly causing anorexia. Again, can't say much here. I've had the flu a few times in my life. Not exactly enough to cause something serious. Then we have effects of medication. Antibiotics, amphetamines, chemotherapy, digoxin, fluoxetine, hydrazine, and opioids all could possibly cause anorexia. Again, I can't say much. I've taken like basic pain medication. There are some effects to your health, of course, if this condition continues on for long periods of time, such as malnutrition and weight loss, if you're the type of person who either avoids food because you don't want to eat or just don't feel like you need to eat because you aren't hungry. If anything, I could use a few less pounds, but not eating isn't very helpful. Now, with all things, there's a way to prevent it. For example, managing underlying conditions before they can become problems. Ask your doctors for side effects of medication. Don't skip meals if you can help it, and eat small portions so you don't make yourself sick. And some regular light exercise. Now, this is just having a healthy lifestyle. Nothing too difficult, but it is also plausible for someone to see this step as difficult. I, myself, have this issue. I want to start doing better to improve my health, and yet every time I try, I'll start out going strong, and then I slack off and eventually forget. Now, I don't expect something. I need to be harder on myself and get into a routine. Just like with preventative measures, there is a time where it has gotten too bad and you need to see a doctor, such as if symptoms persist for long periods of time, sudden weight loss, the added symptoms of fatigue, weakness, nausea, rapid heart rate, or irritability. Now, given this, I am quite few of these, so, one moment, please. And that's all I have to share with you on anorexia. So, this is it for the video. Now, if you are the type of person who happens to look at the progress bar, you'll see that this isn't actually the full end. Since this video is also doubling as my final assignment for my health science class, I will be going over what I learned in more detail for my teacher to see how much I learned. However, this is where the video will end for you, my friends. Unless you want to hear me rabble on more, but I'm sure you have more important things to do than just listen to me keep talking. So, this is where we part. Until the next time I post something. Which will most likely be another health PSA for school. Okay, bye! Now to go over what I learned, well, I learned about how orthostatic hypotension is just a cover-up for more dangerous conditions if it goes on for too long. I also learned how just getting a bit dizzy from standing up is mild orthostatic hypotension. I always just thought it was just its own thing of dizziness. But no, it has a proper medical term and can be a serious condition or hold an underlying condition if not treated or looked into after a long amount of time. Then there's anorexia, where people are often losing weight while I gain it, which it's still not good, but it puts me in somewhat of a better spot. Yes, there's the risk of diabetes, possibly, as I myself have indulged quite a bit into the snacks of the sugary variety over the course of my life, and the lack of physical activity doesn't help. However, if I am able to get the motivation to just settle down and get a flat routine of, at this time, do however many squats or whatever, just go on a run, just start getting to a point where I can become healthier and am no longer at risk of any major issues before they become even worse. This has been quite the eye-opener for myself, as these are very real conditions and I could quite possibly have one of them. Even though I'm not clinically diagnosed, I'm just pretty sure I have it, which I should get diagnosed at some point. I'm probably going to do so after this recording. This research is quite possibly the pushing to start being more healthy and actually try and start a routine to stick to. I did look into the home treatment methods, and while a lot of them aren't too bad and I could have said them for the video, such as the compression stockings for orthostatic hypotension, I couldn't, in good conscience, offer those remedies when I myself am not a trained professional, and I'd rather not have a lawsuit on my hands before I'm 18, or ever, preferably. As for what I learned with orthostatic hypotension, I'm hoping to send this video to my friend Yin, and hopefully they can then show the orthostatic hypotension portion to their parents, so then they can get a better grip on the situation at hand. As I hope with a lot of people, they can also use this video in particular to just take the information and show it to their parents and just be like, hey, I have some of these symptoms, and yes, not all of them fit, but she has this and doesn't fit all the requirements, so maybe we should go to a doctor and check so we can see if I possibly have this as well. But that's the whole reason why I wanted to make this into a video, like I did with, I tried doing a daily health challenge on this channel, did not work, and then we also have the thing I did for my psychology class with eating healthy. So, yeah, this is just a health PSA channel at this point. Which is fine, I don't mind. Anyhow. I might go over some other conditions and just make a series of being like, hey, here are 2 major diseases or just issues, here's all the information on them, the risk factors and all that, and yeah. Who knows, I could make a living off this. Probably not, but that wasn't even in the script, that's just me rambling. Because I had more to say, but I did not write it in. I'm going to be completely honest. I spent more time on my script than the actual research portion. But I found reliable sources from official medical sites so that the information wouldn't vary too much, and I could spend more time on other things, like writing the script and recording it at 1 in the morning. I do sleep, I swear. I just got a motivation boost and I'm gonna ride it till I crash so I can get some things that I've been putting off done. Anywho, thank you for taking the time to watch and mark this, and I hope you have a good rest of your day. or night, whenever you get around to watching this.